Inhale Wellness, Not Smoke by Puolani Casey. Detrimental effects of smoking include increased risk of cancer, emphysema, chronic obstructive pulmonary disease, heart attack, stroke, deep vein thrombosis, nerve damage, and early death. Benefits to quitting are many. Your pulse rate decreases, temperature of hands and feet normalize, carbon monoxide levels decrease, risk of heart attack decreases, oxygen in blood increases, nerve endings start to regrow, sense of smell and taste improves, circulation improves, lung function improves, decreased risk of cancer if not present at the time of quitting, blood pressure improves, fewer coughs, cold, and flu, decreased fatigue and shortness of breath, reduction of lung infections, decreased risk of stroke, emphysema, deep vein thrombosis, chronic obstructive pulmonary disease, and early death. Smoke-free workforce. The workforce cessation programs are among the best ways for employers to improve employee health. Worksite cessation programs are needed and appreciated by employees and are effective in increasing smoking cessation. In most parts of Europe, smokers still encounter many practical and financial barriers to obtaining effective cessation support, and employers can play an important role in helping smokers to get the help they need. For organizations of all sizes, smoking cessation programs are highly valuable investment. Research shows that employees do want smoking cessation programs, and they are of huge value to people who want to stop smoking. Their introduction is therefore an effective human resource strategy that can increase the motivation and loyalty of the workforce. The benefits of a smoke-free workforce include a healthier workforce, decreased absenteeism, meaning less sick calls, decreased healthcare costs for employees, increased employer-employee work satisfaction, and healthy environment for clients and visitors. Readiness for treatment, on the other hand, focuses on motivation to seek help, preparedness to engage in treatment activities, and how they can impact patient treatment attendance, compliance, and outcome. To assess and know when a person is ready to quit, you need to know what stage they are, what construct they are in any model of or theory of change. In the trans-theoretical model, the preparation stage is when they have made a commitment to quit, usually in the next 30 days, and has begun developing a plan for quitting. In the health belief model, the construct that they're ready is the cues to action, strategies to activate readiness to quit within tobacco user. Social cognitive theory, they are ready when they meet the construct of self-efficacy, a tobacco user's confidence and beliefs to perform behaviors to bring out cessation of tobacco use. And the theory of reasoned action, or the theory of planned behavior, throughout the whole theory, the more positive the construct is, the greater chance of cessation. The effects of role models. Role models play a significant role in influencing adolescents ages 15 to 19 to smoke. One study found that their findings are in agreement with the observation by the WHO that adolescents whose parents or siblings smoke or whose friends do are particularly likely to use tobacco themselves. Other role models would include teachers, celebrities, peer groups, cultural norms, other family members, and anyone the individual looks up to. Bottom line is, risk of smoking increases if role models smoke, and that would be of any age. The effects that role models can play, especially in positive lifestyle influences, is be physically active with the children you influence. Eat healthy and provide healthy meals to the children you influence. Have a positive guidance to children you influence. Do not smoke. And if you do smoke, don't do it in front of the children. Treat yourself to decrease stress, anxiety, and fear. And the children will learn to do that for themselves. Set reasonable boundaries for yourself and children. Follow through with promises and goals, and show your love even when your children make poor decisions. Motivational strategies using the trans-theoretical model. In the pre-contemplation stage, you can really give positive information and positive education. In the contemplation stage, positive discussion and feedback about the pros and cons of behavior change. Yes, positive even with the cons. Identify with the smoker. Preparation. Discuss small steps that don't feel intimidating enough to make the smoker feel like they're going to fail, and recognize the support available with them. The action stage. You help gather alternative activities or exercises when having the urge to smoke, and recognize what can be modified. Maintenance. Encourage recognition of positive health factors that have changed for the smoker since quitting. Help recognize triggers and a plan of action when a trigger is happening. And termination. If the smoker even reaches this stage, they should be feeling healthy without the thought of smoking, and they're okay with not smoking. But positive feedback may still help in this stage. Smoking cessation aids include nicotine gum, where cessation starts immediately. It's about a 40% effectiveness, provides 2 to 4 milligrams of nicotine per piece. It can cause mouth ulcers and nausea, and you cannot use it while you're pregnant. It costs about $30 to $50 per week. Other aids are the transdermal patches. There are 2 types. The step down, which does aid in cessation by relieving nicotine withdrawal symptoms. Step 1 is a 15 to 21 milligram dose. Step 2 is a 10 to 14 milligram dose. And Step 3 is a 5 to 7 milligram dose. And it's a type of weaning to make the symptoms less severe and withdrawal more gradual. Used alone is 25% effective, but used with mecamphetamine is 40% effective. It can cause skin irritation, redness, and rapid heart rate, and it also costs about $30 to $50 per week. The single dose does still aid in cessation and relieving nicotine withdrawal symptoms. It's about 15 milligrams of nicotine in each dose, eliminates the step-down effect. Used alone is also 25% effective. Used in addition to the mecamphetamine is 40% effective. It can also cause skin irritation, redness, and rapid heart rate, and also cost $30 to $50 weekly.